Ready? Okay, go. Hey guys, me and Jen are just going to make you a little cap change and lab draw video so you all can watch this before you come in to do your check off. So one of the big changes that came out in this new cap change policy is there are different flush amounts and waste amounts based on the size of the line. So it's really, really important that you know what size PICC or Broviac or central line you have. So a 1.9 French, so if you had a little baby that had a 1.9, there's no lab draws. A 2.6 French, you can only draw from the red lumen. Your 3 French PICCs are kind of your outlier that's going to be different from a central line that's a 4 French or larger, or your ports. So 4 French and larger, you're going to flush it with 5 to 10 mLs of saline, and then your waste amounts are always going to be 2 to 3 of waste. Your ports, think about a port, it does have that well inside of the port, so you always have to flush it with 5 to 10 of saline. And then anytime that you're wasting, you have to waste 5 mLs to make sure that you're pulling all of that blood through the port and you're getting your right labs. So your 3 French is a little bit of an outlier. So for a 3 French, you can only use 3 to 5 of normal saline to flush, and then you have to waste 2 to 3. These normal saline amounts to flush with is really, really important if you're going to do the push-pull method that they showed you in Skills Day, because if you have too much saline in the line or in your syringe, your labs are going to be off when you do the push-pull. But we'll talk through a little bit more that once we get our caps changed and we draw our labs. But just remember, this is really important to know. We're never going to remember this, so Jen's going to make you all a reference, but this is in the policy. The other thing I just wanted to tell you all too, if you do the regular discard method, you draw your blood back, that's going to be your discard. You'll waste 2 to 3, or 5 for your ports. But these are also the waste amounts. If you're doing the push-pull method, each time you pull back, you at least have to pull back 2 to 3, or if it's a port, every time you pull back, you have to pull back 5 and then give 5 back, pull back 5. So just kind of think through that. If your kiddo has IV fluids going when they get back to you, before you disconnect the IV fluids from the cap, they want you to clean with a CHG, disconnect your IV fluids, and then red cap the IV fluids. So any IV fluid you're disconnecting, really from even a peripheral line, but any central line, you've got to have a red cap. Don't put it into that first loop on the port, and definitely don't leave it open. So just kind of keep that in mind. You will have to get a few supplies because you're going to do some of this non-sterile, so you'll need some regular gloves. You do have sterile gloves in the back. Just remember, if you're doing a central line cap change or dressing change, that you are to have a hat and mask on. Anybody else that's up close to the patient has to have a hat and a mask on, which you'd already have a hat. If you're in a room where you may not have a mask, like Dr. Ray's, just make sure you grab a mask. And then, like, if you had anybody that's kind of up here, the CRNA or anybody, they would need to wear a mask as well. And if you could put a mask on the patient, if they'll tolerate that, just in case, so they don't cough onto your line too. Most of your stuff in the back should be sterile, but whatever surface you're going to use, just make sure you clean that really good with purple wipes, just a good, nice, clean surface for your sterile stuff. And then all your jewelry from your elbows down has to come off. And if you're wearing a jacket, it's got to be above your elbows. So elbows and below, everything comes off. Rings, watches, and no sleeves. All right, so let's get into it. We're going to clean gloves, or we're going to clean our hands. First set of clean gloves. You'll see here on your pack you have a tear part, so just rip that open. This is going to flip down towards you. So your first pouch, you're going to have a lot of your PPE. So if you didn't have a mask, you didn't have a hat for whatever reason, that's in your first pouch. Your sterile drape is also in your first pouch that you'll put underneath the patient. We won't need a mask, we won't need hats because we've already done that, so we're just going to discard these. The sterile pad is not sterile anymore like it used to be, so at this point while you're clean, you can go ahead and put this underneath the patient. You can go ahead and touch your caps, just get that underneath there, that's your barrier. And that's all that's in the first pouch. The second pouch you'll tear open. Okay, so be careful when you open up the sterile gloves from here. You're gonna have 2 hand sanitizers inside of this pack, so make sure you don't just open these and fling them across the room. And you're gonna use this hand sanitizer a couple more times before you get sterile. So I would just set them to another spot that you can get to them. In this scenario, this is gonna take up this whole spot, so I can't use these here, so I'm just putting this on the bed, so these will be ready when we need those. Okay, so at this point, you could go ahead and disconnect your IV fluids, red cap them. The other thing they want you to do before you get sterile is check the mobility of your caps. Just make sure that they are movable. So once you're sterile, those aren't glued on with CHG and you're not looking for hemostats. So I've touched dirty caps, been touching some dirty things. I'm gonna take this first set of gloves off, discard them, use my first hand sanitizer. Hand sanitize my hands really good. Another pair of clean gloves. And you can finish opening up your pack. So you'll see here it says pinch here, so just make sure you pinch those. Open that up. All right, and at this point we are ready to get sterile. So if you had forgotten to check the mobility of your caps, you had forgotten some supplies, anything else, this is your last chance to get sterile. So we'll take our clean gloves off. We have our last hand sanitize our hands. And then we're gonna go ahead and get our sterile gloves on. I can get my hands underneath here.
Remember, Cody,
come on,
you can touch this whole
that
whole inch barrier out there. You can touch that.
This is making me mad. Okay, there we go. I'm gonna be honest, I have not put sterile gloves on in a long time. I know you
just want to touch that cuff and
Okay,
wiggle those fingers.
Be warned, these sterile gloves are terrible.
They usually are.
You know, and if you knew that you have like a big hand or a small hand, you could just get your own pack of sterile gloves. You don't have to use the ones that are in here, because clearly I'm on the struggle bus. All right, we are sterile. All right, so now in your pack, you can touch all over this except for that 1 inch around. So in your pack, you're gonna have 2 flushes and 2 caps. So if you have a double lumen, you're good to go. Your caps are inside of this little styrofoam pouch. And just remember, anything you're discarding off your sterile, discard off of your sterile field. All right, so you'll go ahead and prime your caps. Now this is where I want to draw your attention to this. If this was a 3 French PICC line, I'm going to touch some things. I'm not breaking sterility. If this was a 3 French, you can only flush this with 5 mLs of saline if you're going to do the push-pull method. So you would have to go ahead and discard down to 5 mLs. This can get wet with saline, but I would still just kind of discard over here on the side but you really only have to do this if it's that 3 French. So go ahead and prime both of your caps. You're discarding off of your field. Okay, my caps are primed. In your next pouch, step 3, you're gonna have a bunch of gauze in here. So you're gonna open up your CHGs as well. And this is gonna sound really silly, but just remember, one single gauze goes onto your sterile field for each CHG you're gonna need, and the single gauze is only for your CHG to sit on. So if it's a double lumen, you'll get a single for each CHG that you need to clean with. Open up your CHG, put that on your pad, and that's just to keep the CHG from getting on your sterile field pad, and then just keep these ready to get to.
Because those CHG wipes, they will soak through.
Yeah. It seems silly that it can get wet with water but not CHG, but that's what we're doing. All right, so the gauze that you have left, I've been calling these the oven mitts. These are just so you can touch on the caps and the lines and not get your sterile gloves dirty or contaminated. So I will tell you this too, these are huge, so I would double these over. So when you go to pick up your line, it's not coming up over the cap where they want you to clean. So with your non-dominant hand, you're gonna pick up your first cap. You wanna kind of get it pretty far back here. I'm going to get another oven mitt to take the cap off because I wanna make sure my sterile gloves stay sterile. And take that cap off. And then just make sure you don't put your cap back on the sterile fields wherever you're gonna discard those at. Then you'll get a CHG and you're gonna clean the line really good. Remember, you clean for 15 seconds and you let it dry for 30 seconds. So I've cleaned for 15, we've let it dry for 30. We're gonna put our cap on. Okay, that one's done, good to go. I always say change all of your caps before you start doing any labs or trying to hep lock or flush or anything. Just get the sterile part done first. Pick up your other cap. You'll get another oven mitt to take your cap off. Discard off, get your CHG, clean for 15 seconds, let it dry for 30, and put your new cap on. And at that point, your sterile piece of this is done. So then you can work on your lab draw stuff, and we'll show you what that's gonna look like. So one of these I'm gonna do the old push-pull method, and one of them I'm going to do the discard method. But I do gotta get rid of this saline, so disregard what I'm doing right here. So we're gonna say that this is a 3 French pick, so I only have 5 mLs of saline in both of these. Okay, so it's a 3 French, so I have to flush it with 5 of saline, so I'm gonna unclamp. I'm going to flush with 5 of saline, give it a good hard flush, or that push pause method that they taught you all. So you flushed it, clamp your line. Well, you can actually, if you're doing the discard method, you can just pull your waste back into this syringe. So I've pulled back 2 to 3, disconnect, and then hook up your clean syringe to draw your lab. And at that point, flush it and hep lock it, or flush it and hook it back up to fluids. So that one's done. So this, we're gonna do the push-pull method. So this is the kind of the new method they showed you, and they're okay with you doing either. So we're going to unclamp, give it a really good flush of 5 of saline, and then it says to waste 2 to 3 mLs, but that's, since it's the push-pull, each time you pull back, we gotta do 2 to 3. So we're gonna pull back 3 mLs of blood, we're gonna give it back. That's number 1. Pull back to 3, give it back, that's number 2. Pull back 3 mLs, give it back, That is 3. Pull back to 3. Give it back one more time. And that is your 4th time. You cannot draw labs into this, or you can't draw labs into this syringe because there's been normal saline at that. So once you've gave that 4th one back, you're going to disconnect, hook up a new syringe, and then that will be your specimen. Just to drive it home a little bit on the push-pull, if you do it correctly, if your salines are right and you pull back the right amount each time, all of the blood that is in this central line at that point is truly whole blood. So you should be getting a really good, accurate specimen. I think that's it. Jen will do your checkoffs.
Thank you, guys.
See you later.